High risk for breast cancer are often canceled to have yearly annual breast MRIs. The only problem with that was that MRIs had a high rate of false positives. And of course, as you can imagine, that caused some needless anxiety in patients. And today's Focus for the Cure News Channel 5's Kelly Dunn shows us a new study that has important information for those high risk women who have breast MRIs.
The American Cancer Society recommends annual screening MRIs for women who are at high risk for breast cancer. Sometimes an MRI will have crystal clear results, like this MRI, which unequivocally shows a malignancy. But one of the anxiety-provoking things about breast MRIs is that sometimes a woman is given a false positive.
That means that the patient would get a read that they might have cancer, and that would be false, that they did not have cancer.
That false positive can be a gut-wrenching experience. But a new study has good news for those women who have to have those yearly breast MRIs.
What we have discovered is that a woman who comes back after a year and has another annual screening MRI, this second exam raises the sensitivity and specificity of the first examination. Therefore, there are less false positives with a repeat MRI examination of the breasts.
When you see what this means, it makes perfect sense. Here's an MRI that's difficult to interpret.
There are multiple areas of abnormal enhancement within the breast. One can see that the same area is enhanced. This is 2 years later. Therefore, we know that these areas on the second examination, which have been proven to be stable, are less likely to be malignant.
So that means there are fewer unnecessary callbacks, and high-risk women who have yearly exams can be confident that their results are accurate. Kelly Dunn, WPTV News Channel 5.
For more